in the order of the. Do you want to start by talking about you, Amy, and your
Sure.
role? Okay.
Sure. So I've been with I was with Unified for about 7 years and then left for about 15 months and came back here recently to the client service manager role. So I manage the team of specialists here that work with our clients to reduce their overhead.
Chris?
Hi, I'm Chris. I'm the business development manager, so responsible for bringing in new accounts, following up from any events, anything like that.
Welcome.
And Becky, are you feeling up to talking?
She just dropped something.
Oh, I think we just lost Becky.
She's coming back in.
Maybe she will come back on. Becky isn't feeling the best today, and she's also. Oh, here she comes.
It's probably her.
Okay.
I want to tell her.
Hey there, I'm finally in. Hello,
All
everybody.
right.
Sorry about that.
Becky, you
Good.
sound pretty good today.
I'm doing a little bit better. You
want to introduce yourself?
Hi, I'm Becky Larson, and I am in client services for Unified Smiles.
Danielle, have you?
Well, you guys have met me, but I'm Danielle and I work with Guy doing some of the vendor partner stuff as well as the accounting side of Unified Smiles.
Good.
I think that's it. And then there's me, and everybody knows me.
And Denny, you probably want to give a little brief on how you're affiliated and with this.
Yep, and again, I'm Dennis Richardson. I think many of you have met me over the last few years that we've been discussing, this program as well as some of the disability programs that we were looking to launch with membership. But I really do think that this benefit offering is going to be something that I think can really be of significant value to the partners at Unified Smiles. I know it's something that you guys have been looking at, trying to put together for some time, and I think we're getting close.
Yeah, and we think this quarter coming up is going to be including September, is going to be a great time to chat with people about this very topic. That this is kind of when most companies are starting to think about their renewal notices coming up, their historical experience with the program. Is it doing what they need it to do in the office in terms of covering, retaining people, et cetera?
Well, Guy, I think you just led perfectly into my beginning. If you're good, I would get into the program, explain a little bit about myself, our company, and get into the program if you're good.
Yep, I'm good.
Okay. Hello, everyone. My name is Bernard Rubenstein. I am the managing director for Franchise Benefit Solutions. I've been in the business over 40 years. I started Franchise Benefit Solutions, I think, in 1983 or 85. It's been so long now. And again, I'm the managing director, and I'm going to welcome everyone to the webinar here. Providing quality, affordable employee benefits is one of the most critical issues facing the franchise community today. By offering a benefits program, franchisees are better able to compete for and retain skilled and experienced employees. Many franchisees may not offer this important benefit. This may be because employee benefits are often expensive and inflexible and don't take into account the needs of many companies. With over 35 years in specializing customized benefit programs to the franchise community, our firm provides exclusive plan designs to franchisees across the United States. Over the years, we've had the privilege of partnering with Authority Brands, Valpak, Comfort Care, Grocery Outlet, The Joint Chiropractic, and Jenny Craig, amongst others. In recent years, the insurance industry has witnessed many changes. Our clients are aware of the changes going on, and many have expressed an interest in offering alternative benefit plans to help recruit and retain employees. So what makes us different? We understand the franchise industry. We focus on building a benefit strategy and developing long-term relationships. We offer training and support for prospective franchisees. And I know I'm talking franchisees, and your model is a little different, but overall, we look at this as a franchisee type of program, and similar to what we do now is what we would consider your model the same.
You would, each office or each tax ID number would all stand on its own when they're dealing with it, right? I mean, it's, yeah.
Correct.
They
So
pick their
basically
own
what we do is we look at the whole program.
Yep.
Even though your model is a little different, it would be the same as what we do with the franchisee clients that we work with. We offer an online quoting portal, which is the ability for your model for management and non-managed to obtain instant quotes from our multiple insurance carriers. We offer a branded webpage linked to your corporate site outlining our products and services available. So why do clients choose us? We know what it means to be, again, I'm going to just use the word franchisee. We're experts in the healthcare industry. We know or have the knowledge of healthcare reform. We have outstanding service, and most of all, franchisees trust us. Our advantages include we offer affordable group plans and rates, all with guaranteed acceptance and no waiting periods. Plans and rates are the same no matter where your franchisees are located. If you have a franchisee in Florida, Michigan, Washington, or California, the plans and rates are the same. There are no participation or contribution requirements. Plans can be employer paid, standalone, voluntary, or packaged together through payroll deduction. Your employers choose the benefits they want to offer their employees, and employees enroll online through our online portal. Our program portfolio includes medical, dental, vision, life, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. Again, plans can be employer paid, standalone, voluntary, or packaged together through convenient payroll deduction. We offer 3 health plan options: individual and family, comprehensive major medical group health plans, and voluntary group health plans. For those employers that don't want to offer a group plan for their employees, but are looking for an individual health plan for themselves or their family, we offer an online quoting portal they can view at their own convenience. Once they input their personal information, they can compare affordable health plans from different carriers, find out if they qualify for financial help, view benefits at a glance, view local providers, and apply online or download enrollment forms. On the right there, you can see where once they input their information, and let's say they're looking for a plan similar to the marketplace, they would put their info in, and what comes back, what they view is the plans from the lowest rate to the highest rate. And we just happen to run here in Michigan, a couple of Blue Cross plans. So the 432.35 you see does include the subsidy. So at the top left there, the estimated monthly subsidy is $246. So the actual cost of this would be about $670, but with the subsidy, it's about $432. So underneath there, you can see the plan details, and there's an overview of the plan details right there also. views similar plans and find local doctors. And then once they click the add to cart, then this is what they would be applying for. So this is on the individual side. For those employers that are considering their group options, we can help them make the right decision that best meets their healthcare needs for their business and their employees. Group plans are based on the demographics of their company, along with their employee and dependent ages. We would need census information in order to provide them with a group plan. And this is for groups that are under 50 full-time employees. We offer ACA and non-ACA compliant plans. ACA compliant plans are community rated, while the non-ACA plans are based on the demographics and medical history of their employees. Non-ACA plans can be much lower cost than the ACA plans. Non-ACA plans are generally around 30% lower than the ACA plans. However, the ACA plans require 2 enrolled employees, while the non-ACA may require 5 or 10 employees. ACA plans will allow waivers such as Medicare, Medicaid, Marketplace, spousal coverage, or other group plans. So if an employee, let's say you have a group of 10 and 5 of them have one of the eligible waivers, then they're considered a five-man group, and then we would need at least 2. Non-ACA plans, if you have 10 employees, 5 have to enroll. There are no, they will not accept any waivers. So if you have 10 employees, 5 would have to enroll, even though they may have additional employees that have coverage that ACA plans would allow as a waiver. So far, I've covered 2 of the 3 healthcare options, individual and family, and comprehensive major medical. Our third and most popular option is our low-cost voluntary group health plans, similar to an association plan. Our voluntary MEC and limited medical plans are all about easy access, low hurdle to the healthcare system, otherwise unattainable for many employees. For the comprehensive, an average cost for, let's say, a Blue Cross plan may be $500-600, where most employees aren't able to handle the contribution of, let's say, half of $250, whereas our MEC and limited plans are around $100, if not less. The basic MEC, which you see on the screen, covers preventative services only, while the MEC Plus, Premium MEC, and Super MEC plans cover preventative services, primary care and specialist visits, along with urgent care, lab and x-ray services, and generic prescription drugs. So the basic MEC, 100% preventative, covers wellness exams, immunizations, any type of testing, flu shots, colonoscopy, and mammography screening. So again, 100%. The average cost is around $60 for the basic MEC. The MEC Plus average cost is around $110. Primary care visit or wellness and preventative services are covered 100%. Primary care visit, $15 copay. Specialist visit, $15 copay. Urgent care, $50 copay. Lab and x-ray is $50 copay. And generic prescription drugs, $15 copay. Now, what is not covered is inpatient, outpatient, and emergency services, but we do have a hospital confinement plan that employers will offer as a package at employee 100% pay. The value added benefit are benefits that are paid to the employee. So the MEC plans, as you see above, the MEC Plus, Premium MEC, and Super MEC are the same plans on the top section. the bottom section here, the value added benefits are paid to the employee. So the premium mech and the super mech includes a very limited value added benefit through Aflac that is paid to the employee to help offset some of the out-of-pocket expenses. So the hospital admission under the super mech will pay the has a benefit of $500. Hospital confinement benefit up to $300 per day. Accident, ambulance, diagnostic testing, critical illness, and term life rider benefits are included. The average cost, let's say, of the super mech is around $150. Premium mech probably around $130. Mech Plus, like I said, is around $110. Again, there is no employer participation required or contribution required. So the employer can say, I just want to offer it, don't want to pay for it. They could do that. Doesn't matter if one of your employer groups are in Michigan, California, Florida, wherever they're located, same plan, same rate. We would have this as an exclusive unified Smiles plan. We also offer a limited medical. Now, the MEC plan, there is no balance bill. Simply pay a copay similar to a comprehensive major medical plan. The limited medical plan is a little different, whereas there may be balance bill. For instance, primary care visit, $60 per day. The plan will pay the benefit to the employee. Now, the employee can't assign it to the provider. Most of us, when you visit your primary care, will assign the insurance carrier benefit to the provider. And when you walk in, you sign the form. Basically, you're assigning your insurance plan to the carrier. Same thing here. So this plan will pay $60 per day. If the cost is $120, then there could be a balance. Doesn't mean there will be, but there could be a balance bill of $60. If they are a PPO provider, then let's say the discount is $20. So then the cost would be $100. Balance bill could be $40. Outpatient lab is covered $40 per day. This limited plan offers a little more coverage than the MEC, such as outpatient surgery, anesthesia services, hospital emergency room, hospital room and board, hospital admission, and prescription drugs. So again, this does include a little more coverage, but most employers will go with the MEC plan because most employees would rather just have the copay. The average cost on this plan is around $95 a month. So it is a little cheaper, offers a little more, but you could have the balance bill. Now, we do find employers that will offer the MEC plan and the limited plan together and then contribute towards that and let the employee contribute the balance, whatever the employer does not cover. So those are our two medical plans. Again, limited medical could have a balance bill where the MEC plans do not. In addition to the medical, we offer additional dental plans. Obviously, most of your employer groups are going to have the free service from the dentist. Our plans also include basic and major services such as endodontics, periodontics. So it's really up to the employer group if they want to offer dental. Our plans don't have any waiting periods. We offer vision, 4 plans, 2 from VSP, 2 from IMED. VSP is the #1 carrier in the country, while IMED is #2. VSP, we offer 2 plans, 1224, which means once every year, every 12 months, there's a $10 eye exam copay. Every 24 months or every 2 years for lens, and frames. Which is a $25 copay. 12/12 means it's once a year for the exam and once a year for the lens frames, glasses. IMED also has a 12/24. They also have a 12/12/24, which is exam once a year, lens once a year, and then frames every 2 years. Most employees will have their exam once a year and glasses changed once every 2 years. So we find most will go with the VSP simply because Costco and VisionWorks is part of the retail chain. IMED has 4 different retail chains, but most will most likely go with VSP simply because of Costco. We offer 2 voluntary life plans. I should say 2 life plans. One is a group plan, employer pay of $10,000 per employee. Voluntary life, which is employee pay. Employee can select up to $150,000 on themselves, $50,000 on their spouse, and children up to $10,000. And generally, it's one price for all dependent children. As you can see, the guaranteed issue is whatever the amount the employee selects with no medical questions. Now, this is at the time of enrollment that they're eligible. If they are looking for coverage after the initial enrollment, then there will be medical questions. We offer a telemedicine program, whereas let's say you're at work, you feel sick, you can't go home because you got so much work to do. You could connect by phone, video, or app to a doctor, give them your symptoms. They'll give you a diagnosis and they'll even call in a prescription for you. It's unlimited use for all family members up to 5, and the average cost is around $11. We also have accident and critical illness. Our accident plan, a lot of employers will include with the MEC plans. Benefits are for both inpatient and outpatient treatment of covered accidents. More than 50 benefits are covered on and off the job. It'll also include a lump sum payment for any fracture or dislocation. So let's say, for instance, my son broke his ankle playing baseball, slid in the second base. There's 50 benefits for services in the hospital. And then it'll also have a lump sum payment for him breaking the fracture of his ankle. Guaranteed issue, no underwriting. We've had the same plan and rates since 2014. Critical illness. Our plan provides a lump sum payment upon diagnosis of 20 different covered illnesses. Benefit amounts are available up to $20,000 for the employee and $10,000 for the spouse. Dependent children are covered at 25% of the employee insured amount. And it also includes a annual health screening benefit. Finally, hospital indemnity plan. I mentioned at the beginning when I spoke about the MEC plans. Most employers will offer the hospital indemnity alongside the MEC plan. Covers both injuries and sickness. Includes a hospital admission per day, hospital confinement. Covers outpatient medical treatment received in the emergency room or the physician's office. Surgery, anesthesia, diagnostic testing, and prescription drugs benefits are also included. And again, this hospital indemnity or hospital confinement, most employers will include this to include the hospital confinement alongside the voluntary medical plan. Short-term disability, we offer 3 monthly options. Benefit options could be $500, $1,000, or $1,500. Plan pays 60% up to whatever the selected benefit amount is. Plan duration is up to 6 months. And there is a 14-day waiting period for both sickness and accident. Finally, we offer a discount prescription mail order. Free benefit to all employer groups and their employees. Savings up to 80% on prescription medication. So basically, if you're on a 90-day supply, you could speak to the Canadian Med Store. They'll give you a price for the 90-day supply. I spoke to a group recently that was paying $1,400 and they were able to cut down their 90-day supply to $400. Our services include consolidated billing, online HR services, Section 125 premium only plan, which allows the employer group to deduct the contributions from the employees. And then we also offer COBRA administration for groups that have over 20 employees. So how does our benefit enrollment platform work? And we're talking from the time we speak to one of your employer groups all the way through the enrollment process. Step one is our discovery. This is where the employer, we speak to the employer about what their objectives are, offering benefits, and reflect both the employer and employee needs, their budget. We will gather their group information, discuss their goals, their benefit options, and their budget. So if they're looking for a comprehensive plan, we will provide them with a census form, which is you see on the screen. And we pretty much discuss everything, what they're looking for and what we need in order to move over to step two, which is the analysis. So once we receive their census information, we reach out to our carriers to obtain quotes. Then once we obtain the quote, we will present the benefit option back to the employer, formulate some type of benefit plan of what they're looking. Possibly they're not looking for a comprehensive plan. They just want to offer our voluntary plan. And this is where we formulate some type of benefit plan. It could be set up by class, by voluntary. So we may find where the employer group wants to offer one benefit for the dentist and for the non-dentist, for the admin at the office, then they may want to offer a different plan. So this is where we discuss how they want to formulate their plan. Step three would be the communication strategy. This is a critical component to the benefits planning and management. We will develop an easy to understand benefits communication to the employers to share with their employees. We have two options. One would be a fax, as you can see, the easy to understand communication. We also offer a employee guide. So really there's two options: at a 2-page communication, which briefly goes over what's available, or we offer a employee guide, which is an extended, probably 10-page overview of benefits that are available. We could offer a benefits webinar to the employers so that the employees can view what benefits are offered. And then we also build out an online enrollment platform, which leads up to step 4. Once the employer decides what they want to offer, we provide them with the guide. The enrollment process is a online enrollment portal where the employees would go online, complete their profile, and then go through the enrollment process. So again, once they enter the demographic information, then they select the plans that they want to select. And again, this is where once the employer selects the plan, then the employee would go in and select the plans that have been offered to them. So we offer one application, one bill, one online enrollment and administration system. The employer has complete access to the online portal. They could, once the employees select their plans, then the employer can either go online, download the payroll deduction report, forward it over to their payroll vendor, or there is a link from the portal to the payroll vendor, but there is a cost to the employer group to have the easy access. So again, this is our step from the time we begin the conversation with the employer group all the way through step 4, which would be the enrollment process.
Do you interface with a lot of different payroll processing companies?
We do offer, I know we have ADP, Paychex, Paycor. I think there is a couple other ones. We actually had someone ask me yesterday, there's a payroll vendor called Bambi, which I've never heard of, but we
Yeah.
do, there are different vendors that are part of our enrollment platform. Don't know exactly who they are, but Michael, my son, is our implementation guru, so he'd be able to help the employer on that end. But I would say that a majority of our employer groups that we work with use either Paycor, ADP, or Paychex, but I know there's other vendors that are out there. Now, the local vendors where a group may be in California, those are probably ones that we don't work with, but it would probably be the major vendors that are out there. So looking ahead to 2023, the reason I'm bringing this up, I know it's August, but I'm bringing this up because there's what's called a group special enrollment period. And Guy, I know we spoke about this, where this is the accounting season for us. This is where we enroll most of our groups. And I know we've been talking about when we want to kick off things. This is probably fits in right with our group special enrollment period. So it's a 30-day window between November 15th and December 15th. And we start marketing this type of program probably around end of September, beginning of October. This is under the ACA. Carriers are required to offer an annual group special enrollment period to employer groups who do not meet participation or contribution requirements. I spoke of it during our MEC plans, the ACA and non-ACA plans, where the participation is required. This special enrollment period, there is no participation or contribution requirement. So we enroll probably 80 to 90% of our groups during this 30-day window. So again, it's a 30-day window from November 15th through December 15th. This special enrollment period is under the ACA. Most insurance carriers do not want employer groups to know about it, and most brokers don't want to offer it because they may make only $5 per employee. We, on the other hand, use this as a marketing tool, because it doesn't matter to us if the group has 1 employee or 10 employees, we're going to offer this program. So again, no participation, no contribution requirement. The group plan, we need 2 full-time employees to enroll. We will find that a lot of groups will call us and say, hey, there's only 2 of us, my wife and myself. Well, under this type of program, employee spouse is considered as 1 employee. We would need 1 other employee that is W-2'd. So it must be a full-time active W-2 employee besides the employer to offer this program. And I'm bringing this up because this is really probably the most enrollment that we find. We'll see employer groups that will put this in for management only. And I'll go over in a second on our most popular plans of what employer groups will offer. So I'm stressing this type of program. Most of us know about the Obamacare, the marketplace, which it really is October through December. This is an addition to that, which is on the group side. So what are our most popular solutions to help hire and retain employees? Package 1 is where the employer group offers a dual MEC plan and contributes towards the employee-only cost. Employee contributes the balance of the employee cost plus dependent cost and any buy-up. So the employer may offer, let's say, 3 MEC plans. They'll contribute towards a low plan, and then the employee will contribute the balance plus dependent and any buy-up. Then the employer offers the voluntary benefits at 100% employee pay. Package 2, employer enrolls in a management-only group health plan through the special enrollment bridge, which I just showed the slide before. Employer contributes towards ownership themselves, 100%, and then management, 50%. Non-management, the employer offers the voluntary benefits at 100% employee pay. So as you can see in package 1, I highlighted the hospital confinement, whereas the employer is going to contribute towards the MEC plan and then offer the voluntary, including the hospital confinement, as employee pay. Package 3, the employer enrolls in a comprehensive group health plan. Employer offers dual medical options. So let's say they're going to offer Blue Cross or United Healthcare. They're going to offer a dual option. Employer contributes 50% of the employee cost. The employee will contribute the balance of the 50% plus dependent, and then any buy-up. The employer then would offer the voluntary plans, all 100% employee pay. In package 4, the employer does not offer any type of comprehensive. They simply offer the voluntary benefits, 100% employee pay, including the additional voluntary benefits. So these are probably the most popular solutions we find. We are finding more of the package 4 than we are. So most employers, we still find package 1. Package 4 is becoming our probably number 2, where the employer is just saying, hey, I don't offer anything. I want to offer something. I'll offer the voluntary benefits, 100% employee pay, because the employees aren't going to know if the employer is contributing or not. So these are the top 4 benefit options that we find that most employers will offer. Many employer groups come from the corporate world and really aren't trained on how to run a business. So we will help you in training your prospective employer groups when it comes to offering benefits. We will help you on why offer benefits to your employees, and that will include attract and retain the best employees, how to increase their bottom line, boost morale, promote employee health and wellness, beat the competition in the race for talent, and create loyalty. So why offer benefits? We stress on why the benefits is beneficial to them. In addition, we will help them set up a strategic benefit plan in advising them, don't offer too much too soon. Discuss benefit offerings with other employer groups, set up a budget, provide plenty of options, and make sure they partner with a broker that they are happy with. Project scope and timeline. I know that we've been talking about setting up a program. It really doesn't take us that long because we offer programs to other franchise systems currently. We do have a marketing plan that we would review with you. We set up the branded page, provide the online quoting engine, develop additional marketing resources that will help you with your employer groups. We'd offer an introductory webinar to all your employer groups. Timeline is probably 2 to 4 weeks, but again, we are getting into the open enrollment period. And I know, Guy, we've talked about this. This is probably a good time to begin the process on moving forward. And like I said, this is perfect timing. This is a view of our branded page. We are working right now on transitioning, setting up a new type of branded page, but we'll provide you once we set everything up. That's pretty much our program, and hopefully I know I've gone through it for the last half hour here, but I'm sure you've probably got some questions.
I'll ask the first one. At the end of the first year, what is there a potential for a large increase if they elect for the health insurance plans?
Good question. We are, again, like I said, we're working on 2023. Our voluntary medical, we're going to have a 2-year rate guarantee. We are talking with the carrier on trying to get a 3-year, but as of right now, we do have a 2-year rate guarantee. Our voluntary benefits, we have and we're looking at MetLife. We have a 3-year rate guarantee right now with a option of 4-year rate guarantee, and it's based on enrollment. So again, medical, 2-year rate guarantee, voluntary benefits, current 3-year with potential of 4-year rate guarantee. So we've expanded our outlook for 2023 and beyond.
In the event that somebody does get a large increase, do you help them with other options?
Oh, definitely.
Okay.
If we had a member who was interested in this, who do we go to?
Are you asking how the process would work with somebody coming to you and who they would contact from my
Yeah,
office?
if we've got one of our members that isn't sure about it but wants to talk.
Or even if they were sure that they wanted to do it, who would they talk to? Either way, both cases, I should say.
Well, again, the branded page will have a contact page there where members can reach out to us. We have our sales staff here, so we would provide you with our contact info. And then in the introductory webinar, we'll have who to reach out to. We have a newsletter that would go out to all your employer groups. We have a contact list on for who do they contact, and then we would provide you that also. So let's say someone reaches out to you and say, hey, we want to know more, then you would have the contact on who to reach out to in our office. And then again, so there's different ways for your members to reach out to us. So once we receive the info, then we would reach out to them and begin the process of reviewing of what they're looking for. Our process of going through the enrollment, where we would quote or we would send them the employer guide, because those are already rates that are available to them, and then move through the process. Hopefully that answered what your question.
Yes, thank you.
One of the things with our membership is, we may have people that don't offer benefits, that just want to offer minimum, or we may have people that already have some type of a benefit, and they're just looking to see if they can get a better deal. And you're able to handle those with health insurance programs that may be more on the above average side. You can help them see if that's caught, if they've got a good deal on it through your program too. But you can handle all levels, whether they don't have benefits and want to put something in, and you can help them figure out what that is. If they just want to discriminate, I guess that was a bad word to use, but if they just want to give certain people in the office benefits, you can help them with figuring out how to do that, and then maybe offer voluntary to everybody else. So it seems like it's more of a consultative approach with each member to figure out, let them know what's available and let them figure out what works with their office, with their current cost structure.
Yes, and that's why on the screen here, where I spoke about the different solutions, different employers, every employer is going to be different. So these are the most popular options that we find. But again, each employer, we start from step 1 all the way to step 4. So again, step 1 is going to be where we identify what they're looking for and determine their budget and gather the information to help them achieve what they're trying to do. So again, each employer group is going to be different. Again, like you said, Guy, they may not want to pay for any of the benefits, just offer it. We've got a option for that. So again, every employer is going to be different. And yes, we will speak to each employer group individually.
Any other questions from the team?
I have a question. So let's say if we have a client that would like to speak with you, how long is the process from somebody, I mean, how soon would somebody from your team be able to reach out to discuss with them? And then if they decided to move forward, how long is the process before they would be able to have benefits for their employees?
That is a really good question. So generally, if we have a prospect that reaches out to us, Karen will generally receive the info and then she will reach out the same day or the next day and set up a call with us. And if she's not able to, one of us will reach out to the group within 24 or 48 hours. And then from there, we go through the process. And again, sometimes it might take a little longer on, what's on the screen here, step 1, because we will send them a form. If they're looking for a comprehensive plan, then it may take a little longer because they will need to provide us with their census information. Now, if they're not looking for a comprehensive and they just want to offer a voluntary, then we will send them the guide, employer guide that day, and then they'll review it. Generally, they'll get back with us the following week and tell us that they want to move forward. And then we figure out what benefits, we'll review what benefits they want to offer. And then once that is set, then we'll send them the employer group information that they will have to complete. We look at if they're going to want, let's say, October 1st as the effective date. All the information, their system set up by the 15th of the previous month in order to have the effective date of the following of the first of the month. If we don't have it, then it would be the following month.
Okay, great. And it does, thank you. And when you refer to census information, is that something that they can find easily? How do they get their census information? Because I know we're going to be asked that question.
Generally, they could, and I'm going to use ADP. They're able to go on to ADP and pull it from there. If not,
Okay.
then most employers will have somebody in their office that can just fill it out real quick and send it right back to us. But again,
Okay.
that really falls on the employer group, on them completing the form and getting it back to us.
Okay,
Yes.
great. Thank you.
Does that census information affect rates? So if one of their employees was on a medication that was, ridiculous or medical history, does that affect the rates that doctor would have, or do they stay the same?
Health history is not, there is no
No check for
health
that.
history requested, and it's not part of the rates because of ACA. However, remember I mentioned the ACA and non-ACA type of programs. The non-ACA is based on medical history, but when we do receive the medical history, and actually we don't receive the medical history, it actually goes directly to the carrier because of HIPAA. And then the carrier uses some type of configuration. And I think it's mainly has to do with the prescriptions, not so much the health history. And that's where they're going to determine the cost of the insurance, but they may be declined or it may be rated. So there's two types. There's ACA, which 99% of employer groups will go with, and then there's the non-ACA, and that the non-ACA is where they can be rated or declined, but generally we don't find groups that are declined. They could be rated to a point where the employer says, "No, I don't want to go with this type of program."
Okay, thank you.
The November to December timeframe is really for more the ACA health insurance programs, right? That you get this break where you hold the cards for 30 days. And so if someone wanted to take advantage of that 30-day period, I'm trying to think that generally they would want that program in effect 1/1. Is that right?
It would be 1/1.
Yeah.
Under the ACA, you have to be enrolled by December 15th. If you go December 16th, you're no longer eligible. So we have in the past worked till midnight.
So they could start the process before November 15th. It's just that you wouldn't be able to process things until the 30-day window opens.
Correct, 100% correct. So we can actually start it in, let's say, October. We may even have the first quarter rates by the end of September, but it's probably safe to say sometime in October, we will have the first quarter rates. And that's when we can start quoting for 1/1 using the special enrollment period to enroll.
And the carriers, since they don't necessarily, they're not fond of that, do they try to delay it or can they not delay it? If
They
somebody wants
cannot
to get
delay
in,
it.
they're going to get in.
Right. I know during COVID, they did delay it just because of everything that was going on. But I would probably say it's safe to say that they won't be delaying it for 1/1/23.
So Bernard, what would you say is the kind of the next step or the timeline in which we'd want to get things moving forward?
I think the next step would be, and I'm not sure, Guy, on your end, who would include on your team there, but we would review the different marketing strategy that we have and what you have and try to bring it together on the next step forward.
Yeah, and we'd have to give you, we've got an updated logo again, so we'd want to get you the updated logo for the landing page. But I think, yeah, we could have a separate discussion of that. We'll powwow after this to chat with people on the call, and we'll get maybe Danielle and I and maybe a marketing person with us on the next call to kind of go over this. Yeah, so I think and then Becky is that marketing person, so she's heard the conversation too. So I think yeah, we could put the three of us on a call to try to figure this out, because it's something that we need to get figured out, because if our clients are interested, potentially the best time for them is this 30-day window between November 15 and December 15, which is going to give them a lot of flexibility that they wouldn't have any other time of the year.
That is correct. What I could do, guys, I could send you our marketing strategy, our plan.
Yeah.
And then it'll give you an insight on our side. And then you could work with your team, and then we can set up a call from there and set it, the procedures, and go from there.
Yeah, and I think
Timeline.
our normal thing is we identify clients. We kind of run well, internally we kind of look at it as a beta. We kind of pop in, we try to find the people that are interested, push them through the process, and that helps us really kind of mass roll out once we've got some people that have done it. But I think in this case, I got to think through it, how we handle this 30-day period, because if you miss it, you have to wait 12 more months.
So
Yeah,
Bernard,
now
would you typically start pushing that marketing in the beginning of October, so that way you have kind of a 45-day lead up to the mid-November date?
Yeah, that's what I was thinking. I was thinking, we really need to get this in place, because if we do a successful push for this November 15 to December 15, all those people will be testimonial people for the next year.
Correct.
And here's the other thing, just a thought here, Guy. I would probably start thinking this in the next couple of weeks because we want to lay the groundwork. So lay the groundwork in September, and we could have a introductory webinar for all of your members, middle towards the end of September, of announcing the program and bringing out the special enrollment period. And then we have special enrollment period marketing pieces that we could send out to your members, or you could send out. And as it gets closer, once a week, twice a week, we send out info as we get closer to the November 15th.
Yeah, I think we potentially can put this on. We do a monthly thing. I think if we targeted this thing to try to hit the October 1, push out to clients, they look for stuff monthly from us. We could have this be, I think it would fit in. It would be a great fit in for that time period.
Okay, a couple questions here, Guy. How many total members do you have?
Well, we've got about 370, 375 dental offices. But some of those are owned, the same person might own more than one. So, I think, the majority of our offices, if we said, what is your locations, if we averaged it, it would probably be between 2 and 2.5 locations per member. But then we have some that are 25 that bring that average up, so I think a lot of our offices are 1 and 2 locations.
I get it. I would probably, and again, I'll send you our marketing plan, but I would probably think that you may want to lay the groundwork September, and then we generally, when we offer our webinar, we will do one in the morning and another one in the afternoon, so that encompasses different parts of the US because of their time zone. And if their, ability to jump on the webinar. And
Yeah, and what we've done in the past too is we also have a place where we can put it on our web for our members to see. So we can also have it there in addition for people to view later. Put a copy of it. Yep.
Yep, we'll record the webinar, so you can send that out. We have our employer guide, which you can send out to everyone also. And our contact, so you as the franchisor per se would send out the info, and then along with our contact link.
We would have to be careful on the marketing that
Exactly.
don't call them that, because they're going to view themselves as an independent office, but they kind of contract with us to be part of our community. So it's kind of I understand how we're doing it, because each franchisees would be the same as one of our members, but for them, they may not like to hear the word franchise in the marketing, because that would deem that we have some more control than what we do.
Right, and that's why I will send you the marketing, and then work together on how we want to identify and word it.
Okay. All right. I don't know. Did anyone else have any questions? I think this was a good presentation. I think, and it's timely, like we talked about. So yeah, let's keep this process going, and let's see how many we can push through.
Right, you'll send over the marketing guide for them to review, so they can kind of powwow together and discuss it. When do we want to then try to make sure we follow up to make sure we can stay on the timeline?
September is a crazy month for us too. Was that September's next week? Yeah. So we've got 3 or 4 different events that we've got that we're sending bunches of us out of town. But we can fit it in between those. We just have to try to try to figure it out. So, we potentially, the week of the Labor Day week, I think is gonna be a tough one. There's gonna be a lot of us at an event that the following week, I think it's me. But I think potentially we have the 15th, 16th, the 14th. Before Labor Day, next week, we have availability. We don't have anything going on next week.
Do you think you and your team would be able to review that kind of the marketing and be able to give feedback back to us by end of next week?
Yeah, when would we get it?
I'll get it to you this afternoon.
Oh, okay. Yeah, and Danielle will send you the logo too, just so if you're gonna put logo on it, we'll get the new logo on it.
Well,
Oh.
really, what I'm sending you is our marketing, what.
Oh, I
we
see.
would-
Yeah.
What we would work with you on announcing our program. So obviously you have your way of marketing that. So it's just trying to put ABC together.
Yeah, so if we get it today, and hopefully by next week, we have some recoveries, sicknesses. But I think we could set something up for next week, like Thursday or Friday.
Let's put it on the schedule and we can always change it.
Okay. Let's go with Thursday. Want to try for what is that then?
Don't forget. That'll be 2 days before the weekend of Labor Day weekend.
Yeah. Maybe Thursday at 11.
So that would be the 1st.
Yeah.
I'm totally open.
All right, works for me too.
Okay. Do you want to send out another meeting request, and I'll forward it to the people here that will be on it.
What time?
So 11.
11 on the 1st.
Okay.
And we'll look at the stuff prior to that meeting. If you get it to us today, we'll look at it and we'll have it. We'll have our comments kind of figured out.
Okay. I will get it out to you. I appreciate everyone joining. If you have any questions, by all means, please reach out.
We'll do. Thanks
All right,
again.
talk to you guys next week.
Oh, and send us the recording too.
Oh,
Oh, yeah.
yes, I will do that. Okay. Sounds good.
Bye-bye.
Talk to you guys later. See ya.